Ever been haunted by that burning sensation in your chest or an upset stomach after a meal? If so, you're not alone. These symptoms are common signs of GERD that affect over 800 million people globally, and the side effects of the drugs used to treat GERD can be worse than the disease itself. GERD, or gastroesophageal reflux disease, escalates the discomfort, bringing a chronic, often severe form of heartburn. The acid reflux can even make its way up to your throat, leaving a bitter or sour taste. These conditions are more than just annoying inconveniences. They can disrupt your daily life, making routine tasks challenging and diminishing your overall quality of life. For many, a common go-to solution for these issues is a medication known as Prilosec, or its generic name, omeprazole. This little pill is a proton pump inhibitor, a type of medication that works by reducing the production of stomach acid. It's like turning down the volume on your stomach's acid production. But GERD is not an acid problem. It is caused by an anatomical issue. GERD occurs when the valve between the stomach and the esophagus is not working properly and fails to keep contents in the stomach. The acid our stomach produces is important for digestion, killing harmful bacteria and helping with the absorption of electrolytes and other nutrients from the foods we consume. So gastric acid is necessary for proper digestion. Omeprazole suppresses the needed acid. Medications may offer mild to intermittent symptom control, but they do not stop or prevent reflux. Additionally, those who are or may become dependent on daily medication may develop severe complications from GERD, even if no symptoms are experienced. When left untreated, GERD can lead to other health complications including damage to the throat or esophagus, inflammation or narrowing of the esophagus, respiratory complications, Barrett's esophagus, and esophageal cancer. So by decreasing the amount of acid, Prilosec helps to alleviate heartburn symptoms, but causes dependence, which means that with chronic use, your body will eventually stop producing the acid it needs for proper digestion. But it's not just prescribed for GERD. Prilosec is also used to treat other conditions involving excessive stomach acid, such as Zollinger-Ellison syndrome. Additionally, it's part of the treatment plan for healing erosive esophagitis, a condition that occurs when stomach acid repeatedly comes into contact with the lining of the esophagus. When we consider the wide range of conditions it can treat and the temporary relief it can bring to those living with chronic discomfort, it's easy to understand why Prilosec has become a common solution. So it's no surprise that this medication has found its way into many medicine cabinets. But just how many people rely on Prilosec for relief? To understand the magnitude of Prilosec's impact, let's delve into some numbers. It's estimated that over 800 million people across the globe turn to Prilosec, or its generic form, omeprazole, to manage their GERD or indigestion symptoms. In the United States alone, 80 million people use it at least once a month. Prilosec has become a household name, a go-to remedy for those battling the discomfort of heartburn and acidity. It's not just adults, even teens and children are prescribed this drug, highlighting the widespread nature of digestive issues. Babies hospitalized with GERD increased by 42% from 1998 to 2005. Hospitalizations for children between the ages of 2 years old to 17 years old for GERD increased by a shocking 84% during that same time period. This reliance on Prilosec underscores the prevalence of GERD in our society. But why has it increased so much since 1998? Is it our food? Is it stress even in babies? Few studies are done to cure the problem or find the root cause or cure. Prilosec's widespread use presents serious concerns when we consider the unseen risks of chronic use. Like all medications, Prilosec has serious risks. For this reason, it's essential to delve into the suppressed risks of this widely used drug. While Prilosec has proven effective for many in managing the symptoms of GERD and indigestion, it carries potential side effects and risks that are often overlooked. The most common side effects might seem relatively mild and include headaches, nausea, diarrhea, stomach pain, or gas. These symptoms can significantly impact the quality of life for omeprazole users. But let's move beyond these common side effects to the more serious risks associated with Prilosec. Among these is the potential for kidney disease. First, let me say that omeprazole is recommended for a maximum time frame of 6 to 8 weeks. but physicians often recommend chronic daily use beyond 8 weeks, in spite of numerous studies showing that prolonged use of Prilosec can lead to an increased risk of chronic kidney disease. This condition is a serious health issue, as it can progress to kidney failure if left unchecked. I personally known several patients who suffered kidney failure from chronic use of Prilosec. In fact, the drug destroyed my ex-husband's kidneys, and he was on dialysis till the day he died, which seriously compromised the quality and length of his life. Another concern is the risk of bone fractures. Extended use of Prilosec can lead to decreased calcium absorption, which in turn can weaken the bones and increase the risk of fractures. This is particularly concerning for older adults who may already be at risk for osteoporosis. The potential for vitamin B12 deficiency is another lesser-known risk. Prilosec can affect the body's ability to absorb this essential nutrient, leading to a deficiency over time. Symptoms of a B12 deficiency can range from fatigue and weakness to more severe neurological problems. These are just a few of the risks associated with Prilosec. It's important to discuss these potential risks with your healthcare provider before starting any new medication. Knowledge is power, and understanding these risks can help you make informed decisions about your health. But are there more natural approaches to managing GERD, you might ask? Well, the good news is there's a whole world of remedies out there that can help you manage GERD and indigestion in a natural, holistic way. Let's start with dietary changes. You'd be surprised at the power of food in managing your health. Certain foods are known to exacerbate GERD and indigestion. These include spicy foods, citrus fruits, tomatoes, chocolate, and foods high in fat. On the other hand, foods like whole grains, lean proteins, and most vegetables can help mitigate these symptoms. Next, let's talk about lifestyle modifications. Simple changes can have a big impact. For instance, maintaining a healthy weight can decrease pressure on your stomach and reduce the likelihood of acid reflux. Similarly, avoiding meals 2 to 3 hours before bedtime can give your body enough time to digest the food. Regular exercise can also help with digestion. However, it's important to note that intense workouts may worsen GERD symptoms, so opt for low-intensity activities like walking or yoga. As for herbal remedies, there's a plethora of options to explore. Ginger, for example, has been used for centuries to soothe digestive discomfort. Chamomile tea is another popular choice, known for its calming effects. And then there's slippery elm, a herb that has been used by Native Americans for hundreds of years to soothe the digestive tract. Remember, everyone's body is different, and what works for one person may not work for another. So with natural treatment, you may need to try a few times until you get the proper combination. Also, keep in mind that these remedies are most effective when combined with a healthy lifestyle. That means getting regular exercise, maintaining a balanced diet, and managing stress. Lastly, you should know that kidney damage is not unique to Prilosec or omeprazole. All proton pump inhibitors have the same potential side effects, so you don't want to just switch to Nexium or Zegerid OTC. There are other proton pump inhibitors, but that can cause the same kidney damage, but they are rarely used or used only in hospital settings, so overuse is less likely. So if you're looking for a more natural way to manage your GERD and indigestion, consider these options. They can provide relief and help you maintain a healthy, balanced lifestyle. These natural options can offer relief while aligning with your wellness values. Digestive health is a journey, not a destination. It's vital to stay informed and proactive about your health, especially when it comes to something as common as indigestion. Knowledge is power, and it's my mission as the ex-pharmacist to empower you. So don't forget to subscribe to our channel for more health insights, share this video to spread awareness, and hit the like button if you found this information helpful. You don't have to be a slave to the industrial medical system, so start today by breaking free.